topic, I think, from our next two guests. First, I'll introduce them. Andrea Purnell, Artistic Director, Communications Director for University of Missouri St. Louis's Missouri Institute of Mental Health. Thank you for being here. Also, Mark Norwine, The Walking Man, which is, it kind of falls under the artistic realm as well. Tell me about Walking Man. Tell me about how that's changed the way you think about this subject.
Well, I had...
Walking Man is a film, I should say.
It is a film,
just to be clear.
It is a film. It's basically, it follows the walk across the state of Missouri, stopping at many of the rural schools. This was back in 2013, and I was going to do the walk for Chad's Coalition, and it just so happens my son had graduated from USC's film school a few months before, so he went with a crew and followed across the state of Missouri, stopping in rural counties and rural schools because of the fact that they have so few services.
So what did that walk teach you?
It taught me, first of all, that we were a tiny, tiny piece of the puzzle, and that it's such a big topic and such a big problem, and I'm concerned that we can't solve this problem within a generation like a lot of other problems, and it really needs to be because of the number of people that we lose every year to suicide.
Why? What did you learn that made you realize just how are things worse in the rural communities?
Oh, much. Yeah, the suicide rates. Suicide rates are 4 to 5 times higher than, say, St. Louis or Kansas City, and I would say partly because there is a certain type of person that likes to live, out in the country, out in the rural areas, and there's sort of an expectation that you'll be tough and that you'll get through on your own. So you have some of that. You also have a lot of schools that either can't afford or they don't have mental health services nearby, so they don't have people like MIM or Chad's Coalition or these other organizations coming in and talking about it, providing services for it.
Is the stigma greater?
I would say yes. Yeah, definitely. Greater in the rural areas.
How does art play a role in this conversation from your perspective? Tell me how your life experiences, your professional experiences, what is the lens that you see through here?
Sure. I think art plays a wonderful role in this problem that we're having. Just to back up, the Missouri Institute of Mental Health is an over 50-year-old organization. We have a science to service concept. We provide everything from research to evaluation to professional training. We even were part of the Walking Man film, which is fun. But they hired me a few years back from the arts community on purpose to kind of change things up a bit. I think out of the box, especially as it relates to mental health and mental health awareness, and we have done just that. 2 years ago, we produced a 200-person mental health flash mob in downtown St. Louis, and it was full of mental health consumers as well as advocates. A wonderful opportunity for the community to see mental health in a completely different light. We went on and have done many mental health art showcases. We actually have one happening next week at UMSL, and the idea is to use the art to do stigma busting, as we've been talking about in this evening. When you can see the art and see, wow, this is an amazing piece of work, and perhaps something that you would not necessarily think someone with a mental health challenge could produce, and you see it, it makes that person just that much more real. 1 in every 4 will deal with the mental health challenge within their lifetime. So it's happening in families and homes. And I think the arts allows us to talk about it without pointing a finger, as well as really just kind of expose, dispel myths. And we've used everything from, like I said, dance to theater to music. So it's a way, especially even as he's describing with the film, to use the art to spread the message, but maybe not so in your face.
What does it do for the participants? Is it empowering for them?
Oh, extremely empowering. I mean, it just, for many of them, it's a way that they can express themselves. Most oftentimes, if you have a mental health challenge and you don't feel like you can talk to someone, perhaps you can draw what it is that you're feeling and still get that, what I like to call maybe some of that out of you, in whatever capacity. So yeah, most definitely, it can really raise esteem levels quite a bit for those that are dealing with mental health challenges, to work specifically with art therapists, which is very important for me to say. While I'm from the arts community, I'm smart enough to know when you're working with healing arts, you need to collaborate with the right people in order to truly get the message that you're trying to achieve, not only for the end user, the public audience, but also for the person with a mental health challenge that is overcoming because of the art.
This sounds like a pretty good example of something you would have access to living in the St. Louis metropolitan area that you don't have in maybe some of the communities you visited.
Well, not just that, but 75 of our counties out of 110, 115 counties don't even have a licensed psychiatrist in the county. And we are one of the lowest states in terms of child psychiatrists. We have less than 35 child psychiatrists in the state. We have kids that are waiting, that we service, that are waiting 3 months to get an appointment for a first-time appointment. And it's not because the psychiatrists aren't trying to get them in, it's because the psychiatrists are so overloaded. And that's sort of the state of affairs today.
Is it hard to get people to come to the program? Is it easy? Is there a waiting list, or if you're describing a person who may be in a situation where they can't express themselves, I would imagine it would also be hard to show up for something like you're talking about too for the first time.
Sometimes and sometimes not. Just to give you an example, you were talking about culture just a bit earlier, and we've done some very targeted productions. One piece entitled Depression, Whose Disease Is It Anyway? A closer look at mental illness in the African American community. We had 150 audience members coming to think, presumably just to enjoy a show. But by the end of the performance, and I must admit, it's much more than entertainment, it's edutainment, if you will. So in between each vignette, we had a therapist come out and describe what it was that you were seeing, signs and symptoms. So it was like having a therapy session without the couch.
What was the response?
It was amazing. We had people stand up at the end, express their own challenges with family members, and then we had some that even made direct contact that day to want to seek therapy. And we had audience members stand up and say, "That's me. I saw myself in that person." And particularly for this community, this was full of African Americans. Many of them expressed that they generally would not go to a therapist. Unfortunately, it is still a very taboo subject, mental health in the African American community. What goes on in the home stays in the home, right? And so therefore, this was an opportunity for them to see themselves, feel exposed, but still safe, in a very, very safe environment. And it was a very positive response and able to connect with therapy right away. So we were very proud of that project.
I asked the first table what their reaction was to the community discourse around some very high profile tragic losses to suicide. What did the two of you see when you see just kind of the public discourse, the broadcast?
Well, we were actually at the Capitol the day before Tom Schweik died, and we were doing some testimony for mental health. Jill Shoup has a Bill 328 that she's trying to get passed into law, and we were doing testimony. And the next day we went home. The next day Tom dies by suicide. So we were blown away because we had just been up there, and I think in a lot of ways the legislators were blown away, and I think they really realized that really pointed to the fact that we have a real problem, and we have a problem not only with kids but with adults, and every adult was a kid at one time. So we can get this at a much younger age than what we're trying to get it at.
I have to point out something that he said, which just rung in my ear in such a beautiful way. He said died by suicide, notice, versus committed suicide. So what I'd like to point out is, especially as it relates to the communication circle, the education that can come to help not sensationalize a situation. What do you think of when you think of commit? Commit a crime, commit a sin, right? So when someone does die by suicide, their family is still left behind, and they still have to live with that. So we can do a lot just in the communications realm to change the message simply by how we change our language. Another example is person first language. Instead of saying, "Oh, that's a schizophrenic," or "they have depression," you should say, "This is a person that's living with depression or living with schizophrenia." So just those small little things can make a huge difference for how the rest of the community responds, reacts. The reality is that a person with a mental health challenge is a lot more likely to be a victim of a crime than they are to commit a crime. Right? So just those facts, putting them out there will, I think, help bring balance, really bring balance to the situation before we do have a crisis, as was stated earlier.
You feel like that's a subtle, or maybe not so subtle, way of changing the conversation?
Oh, big time. Small but huge impact, simply in how the language is described.
And it's how that person then feels about themselves.
Sure.
Because when you say what, as you said earlier, that person then is such a negative connotation. Of course, they carry that, and they already have mental illness. They carry that further, and
So then it's probably wrong to ask, does a person beat mental illness? I feel like there might be some reaction to the question, the language of the question, and then maybe an
I think
answer.
part of it is what mental illness. I mean, I think there are people that have episodic depression, and maybe they never have it again. I have bipolar disorder, that's with me for life. Our son has bipolar disorder, that's with him for life.
Yeah, and I think you know me well enough. I think you got it. Yeah, beat, as in you're defeating something that's wrong, that's negative, versus, how do you cope with it? I think that's probably perhaps more safe language, because you're right. There are some mental health challenges that will live with you for the rest of your life, and you'll learn how to cope with them. You'll learn how to find different coping strategies that work for you, figure out what your triggers are, what you need to stay away from, those sorts of things. So there are ways to manage. And if it is not medication for you, maybe it's talk therapy, maybe it's exercise. So I also like to encourage people, if they have found something that did not work, try something else. Because there are a variety of different coping mechanisms out there for you.
What do you hope the film accomplishes?
Start conversation, just real simple. Just start conversations. We've handed that video to hundreds and maybe thousands of people that had somebody in their family that needed to see it because they wouldn't get help, and in many cases they got help. So I would say that's the number one focus.
Tell us where we can see it. Can we?
You can get it on iTunes. I think it's around $5 on iTunes. If you have AT&T Uverse, you can get it through that, and you can also get it through DirecTV. You can go to the website walkingmanmovie.com, and you can get a copy that way.
It's showing all over the place,
Yeah,
in California and everywhere. Great success.